home after a hospital visit, for instance, and or services would need to be acquired. Before the woman is discharged, there is medication that needs to be administered for the 48-hour period, and that information needs to be relayed accurately and understood, because this is where the legalities step in, where the family member is responsible because the patient is being discharged to that family member. If that family member feels uncomfortable or there is no family member, then services has to be uh, provided or acquired by that patient in order for the aftercare to be taken care of. And that is a responsibility of the hospital. If they discharge someone, they have to discharge them into someone else's care, or with the understanding that that person has the services, support services necessary to receive the 48 hours of aftercare. That's how quickly someone can become a family caregiver. And even though it's not for a long-term illness or needing long-term care, it can change individuals' lives very quickly. In this scenario, if the person works for a corporation per se, then they may have to call off. They may have to provide even longer time off than the 48 hours, and it causes interruption in their career, especially if it turns out to be a long-term illness as a result of the accident, for example. These are some of the things that a lot of people don't think about or even consider when it comes to family caregiving. As a family caregiver, you're also an advocate. You're fighting for proper care in hospitals, questioning doctors, and navigating confusing insurance policies. All three of those, all three of those points I've experienced as a family caregiver, as well as my family, who provided uh, uh, caregiving to my mother and to my sons, had all of these experiences. There's so much more that we can discuss as it relates to being an advocate, um, for not just for the patient or the family member, but also for yourself. If you don't take care of yourself, if you don't advocate for yourself, then you can't take care of someone else. And so it's important that you understand all of the resources that are available to you so that you can make wise decisions, as well as understand why things are happening uh, to your family member so that you can provide that information to the doctors if something happens. So, with healthcare advocates, we're here to provide you with those support services in when we provide our consulting to you. You can act as a chauffeur. That's even simpler, right? Just driving your family member to appointments, whether it's doctors, physical therapy specialists. When I've worked in the homes of the family members as a nurse's aide, I was able to manage my clients' schedules. So taking them to physical therapy appointments, to doctor's appointments, or even just out to eat, making sure that they stayed active, understanding the resources that were in the community. You see, when I was laid off and became a nurse's aide, by that time I had my second master's degree. I was working for a major university in a high level position, and was laid off as a result of a change in the federal government rules. And so at that time, it was necessary for me to find employment and find it quickly. So typically, working in a high level position, it takes time, more than 6 months, more than a year, to find the same level of position. So I decided to become a nurse's aide in order to get quick income to take care of my four children at the time. And so, if I had the resources that I needed or was aware of what was available to me as a family caregiver, I might have been able to make different changes or different decisions, um, and which included my career. financial planner, paying the bills, managing assets, dealing with Medicare, Medicaid. This is if you are within the sandwich generation. Um, I know that some of the individuals that I consult, they are experiencing their parents who are needing to transition to health insurance resources, but they may have too many assets that they have to offload before they can actually receive the benefits of the insurance. There's so many things to navigate. And if we just, simply talk about paying bills, being the authorized individual to make to pay those bills or to make those decisions, knowing the assets that your parents have, or even the assets that you have that you can utilize to help them, let alone knowing that if you are taking care of your family member, that they could be a tax deduction that you can benefit from providing help to your family members. There's so many things that you as a family caregiver can understand to help you on this journey. Uh, I believe that I have been blessed to experience the journey that I've been on and currently are on, so that I can help other individuals at least get an understanding of what's available. This is not something that's going away. It's not something that's going to get better. I'm a very optimistic person. I don't want to say that it's going to get worse, but it definitely is going to get more intense, especially because of the population, the baby boom population, which is one of the larger populations. They need someone to take care of them, and the healthcare system is not quite prepared to do that. And so it's going to become more and more important for family members to step up and handle all of the different things that are necessary to provide care to your family members. We talked about being the medical assistant, the advocate, a chauffeur, being a financial planner, but those are all physical things. What about being an emotional rock for your family and your family member with the illness and or medical condition? Providing comfort and encouragement and compassion, often while hiding your own stress and fears of what may happen. I for years, I didn't want to truly recognize that my mom was going to die. I always had hope that something, a new drug, a new something would change. But that was a fear or stress that I never really talked about. Our family has not gone through therapy as a family to really understand the true emotions that we all experienced. But those are things that all family caregivers go through. Even if you are a neighbor, these are some things that you can do or experience as a caregiver. There's also an invisible price tag to what it is to being a caregiver, and that includes emotional, physical health, financial strain. For instance, the emotional toll is that the constant stress leads to high rates of anxiety and depression that I didn't realize that I was experiencing. My older son, or both my sons, were born with sickle cell disease. And although the disease was explained to me at the age of 23, at the time of his birth, what could happen. He was one of the children that had a very high hemoglobin, so he didn't experience the disease like most sickle cell patients. And so, although it wasn't a constant uh, uh, physical experience for him, it was every 6 months for the first, I want to say, 9 years, we were in the hospital. It was like clockwork because uh, weather condition changes would affect if his blood would sickle and cause him to have pain. Then all of a sudden, when he started into his preteens, he wasn't having so many crises. They called them sickle cell crisis. And it almost got to the extent where he wasn't experiencing hardly anything. And then our second son was born. So then all of a sudden, we had two children with sickle cell disease. And my second youngest son, he also had asthma. So he had a double whammy of the sickle cell disease and asthma. And anyone who knows anything about sickle cell disease, the reason why, or one of the reasons why the blood sickles is because of lack of oxygen. So if his asthma triggers, then it would trigger his. It was a lot of stress, emotional toll. And I was working full time and I was married and had two other older children, two older daughters, and trying to be all of who God created me to be and not understanding all of the stress that was coming because again, this all just kind of slowly happened. Okay. So my older son was born in 1997, which was also the same year that my mother was diagnosed with AIDS. So all of this is going on at the same time, and I'm not understanding that this is not regular. This is not a typical life, and just trying to handle all of the stress, all while trying to climb the success or career ladder. Um, it was an emotional toll. The physical health of caregivers can get neglected. I was also diagnosed uh, with diabetes around that same time, and I did not take it seriously at all. Um, of course, anyone who's been diagnosed with diabetes, you know, they start you off on the metformin, and you're taking the pill, and you're doing, trying to do the exercise and the eating right, and I did not do any of that. Caregivers often neglect their own health, skipping their own doctor's appointments, not eating properly, and suffering from sleep deprivation. I did all of that successfully. My health declined and stress impounded to the extent that my husband and I divorced. Not now looking back in retrospect, understanding that we're both dealing with stuff, not talking about it, just dealing with it, just putting out fires constantly that led to our divorce. We're friends now, but understanding that this is a lot of toll to put on individuals. Um, there's also a financial strain. Nearly half of caregivers experience significant financial impact. This includes high out of pocket costs for medical supplies and lost wages from reducing work hours or leaving a job entirely. Many people who are Gen X, who are in the sandwich generation, who are providing care to baby boomers, eventually quit their jobs so they can stay home and take care of their family members. That derails their career. There's really no bounce back. When I talk to or provide consulting to individuals who have provided caregiving for years to their parents, after their parents pass away, the question is, now what? I've been doing this for 10, 15 years. Now what do I do? You can't go back to your corporate job. Typically, what I've found that individuals do is that they uh, start a new business, or they take a under career job, a position that they are overqualified for in order to either get back into the workforce, either to earn money or just to stay busy after their family member passes away. There's so many different aspects of family caregiving that we need to understand.